As you know, one of the things that I teach at Harvard is a course on multi-level modeling and both its concept as well as application. And I've done this teaching of multi-level modeling for over 20 years now, and especially this course has been sort of fairly well received wherever I've taught. And the importance of this course, I feel, is something that is very fundamental to how we think about in public health, which is about populations and preventive strategies. So for any training programs that are focused from a very public health perspective, the notions of analyzing the data and coming up with evidence that uses the right kind of methods becomes important. And I think in that context, the role of multi-level methods are really valuable and important as a part of the training toolkit. So first of all, congratulations for starting the MPH program. I think it's really kind of the right way to move forward. And obviously the challenge is there's an opportunity when you're starting new that you can really, it's an open canvas. So you can paint anything you want. The challenge is how do you say what should go into the canvas? And I'm very pleased and very honored to be here that you considered multi-level modeling as a central part of your training that you're doing within MPH. And as you well know, a part of the MPH is moving very much towards how do you bring evidence? And if you talk about evidence, then it's both qualitative and quantitative evidence. And I feel that the setup of MPH program here within a medical school and a dental school is very valuable. And from a multi-level perspective, I see your institution able to bring both the patient perspective and the population perspective simultaneously. And I feel that kind of perspective is very valuable to students who are here, who in my experience all come with a clinical a majority of them have some kind of a clinical background or a clinical affiliation, and they're passionate about patients, right? They're passionate about the individual patients that they look at, but they're also passionate what they can do outside of their clinical rooms. So I feel that this kind of a method is particularly probably appeals to them more, and I'm thankful that you considered that in the mix of the training that you wish to provide. From my own perspective, it's always enriching to interact with people from across the world. And in the last year that I taught, my teaching also improves. Part of teaching is engaging and communication. So to be able to translate these core ideas, but in a relevant way in different countries with different sensibilities, examples, I think I find it both illuminating as well as an opportunity to improve my own ways of thinking about these models and how best to teach them. So I'm looking forward to the comments of people who have done this course last year, to talking to you more, and also how the kind of comments we get from this year. I think my main message will be keep an open mind, keep learning, and that with that perspective, I think then you really will be able to find the solutions that kind of motivates you to do courses like MPH. Because courses like MPH, students who initially come there, it's a professional degree, and you always want to be like how you see in medicine. How can I practice this, right? Both for research, and also my mind is also practice. It's practicing knowledge. But our MPH students will come with this passion of being able to do something, and I think keep up that spirit, And how best we can continue to inspire them and motivate them will be a challenge for us to doing the right kind of courses and experiences to give them.